So the prognosis overall for anti-NMDA receptor encephalitis is quite good overall. With that being said, there is a 6% mortality rate in the same study that Dr. Galentine was talking about with over 500 patients. Of note, some of those patients never received therapy. Certainly patients tend to do better when they receive therapy. They do better when they receive therapy early and the more aggressive therapy. But there are some patients, despite our best efforts, who do not get better from this condition. That being said, 81% of patients had a good outcome, and they defined that as a modified Rankin score of 0 to 2, so with very minimal, if any, disability afterwards. They found that about half of patients responded to first-line therapy, but they also found that in this cohort study, half of patients who didn't respond to first-line therapy did not receive second-line therapy. And part of that, again, comes from the fact there are not standardized treatments for this. So some patients continue to receive first-line therapy because people didn't know what else to treat them with. The other thing that sometimes happens is there's been, in some other autoimmune encephalitises, and also in NMDA, you can have persistent injury from this encephalitis. And so some patients are thought to just have persistent injury, that this is not reversible, and they never get their treatment escalated to second-line therapy. But if you look at patients who were treated with second-line therapy, they had significantly better outcomes than patients who did not receive second-line therapy. So in general, we would say until you can show that this is not reversible, you should be more aggressive in the treatment, because the outcomes for patients, if you're not aggressive, are quite devastating. They did find that about 12% of patients had a relapse within the first 2 years. Patients who were treated actually with second-line therapy had fewer relapse rates, even though you may look at, based on how the study is done, those patients may have had more severe symptoms or been less responsive to initial therapy. They actually did better over the long term in terms of fewer relapses. 2/3 of patients who had a relapse, it was less severe, but in 1/3 of patients, it was actually more severe. Predictors of good outcome, as Dr. Galentine mentioned, are early treatment and moving up to second-line treatment for patients who are not responsive to first-line treatment. So the major take-homes here are that you need to initiate treatments as soon as possible. Be patient. It's kind of a balancing act. You got to be patient, but you also have to be aggressive. So we're not expecting them to be dramatically improved quickly, but we are expecting to see improvement. And if you're not moving towards seeing steady improvement, then you need to be escalating your therapy and be more aggressive. The average time to recovery is 14 months, so that's something to be prepared for both as the provider, but also to prepare families for, because these children and patients are severely affected, and it's very difficult to watch this, and we just have to be, expect slow and steady improvements. And then again, if first-line therapy isn't working, even though second-line therapies are intense, Cytoxan or rituximab, those are big medications, they're very effective for patients with this disease, and we can't be afraid to move toward that.